So how do you approach antibiotic therapy in a real-life pediatric primary care clinic? Passing boards is one thing, but taking care of these patients in a pediatric primary care clinic is totally different skill set. And today we're going to cover that. The first thing I want to talk about is stewardship. In real practice, antibiotics are about more than just treating an infection. With stewardship, you have to think about things like resistance, safety, and like the long-term outcomes of giving antibiotics when the scenario does not call for antibiotics. We start empiric therapy because we do not want to delay care, and then we order a culture, and based on that, we can narrow down or stop the antibiotics when appropriate. So please be aware that our prescribing habits are being tracked. So if we're prescribing too broadly or too often, it does get noticed. Resistance is real, and good stewardship is very important. Anticipatory guidance is very important in the pediatric clinic because even with the right antibiotic, if the family does not give it to the patient correctly, it will not work. So we have to tell the parents and the caregiver they should give the medication as prescribed, continue to give the medication even when the symptoms get better, and discard if there just happens to be something left in the bottom of the bottle. If it's a suspension, then appropriately discard the remaining. Don't save it for the next time that patient gets sick or for when somebody else gets sick. And the truth is, we probably all know somebody that's held on to medications in our personal lives, like even outside of the clinic. Teaching about how to give this medication, it is not extra work. It is part of the prescription process. Now, here's another big one: culture and expectations. You're going to have some families that's going to come to the clinic, bring a pediatric patient into the clinic. Some families are going to want antibiotics, and some families are not going to want antibiotics. For some of them, the ones that want it, if you do not prescribe to them the antibiotics that they come in there seeking, then they're going to think that that visit was a waste of their time, unless you can convey to them that that specific diagnosis does not need antibiotics, and then see if you can get them to verbalize it back to you. Because if they're unclear when they leave, they're going to think that you did not do a good job. And for the patients that do need to take antibiotics, it will need to be explained to them the reason that they need to take antibiotics in this case. So stewardship goes both ways. Stewardship isn't just about saying no. It's also explaining to the families the rationale. Antibiotic therapy is about being intentional. If you're a PNP student or a PNP grad, same for FNP, and you're navigating pediatrics, this channel is all about helping you think clearly and practice with confidence. And if that tickles your fancy, stick around, and I will see you in the next one. Bye-bye.